So this here is what is known as the hook grip. So as you can see, my thumb, as I'm going to demonstrate using station number 2, the items at station number 2, is just stuck to the side as compared to how it was when we were looking at the power grip. So this here is the hook grip, and as you can see, we have flexion of the medial 4 digits. So what I want you guys to know again is that the intensity of this flexion of these medial 4 digits is actually depends on the size of the object that you are carrying. So the larger the size is, the more flexion is required to be able to hold that object to prevent it from downward pull by gravity. So these here are my different bags. As you can see, the sizes of the handles are actually in a kind of ascending order. We have from the smallest, then you have the medium size, right? And then we have the larger size in terms of when you're looking at the handles, right? The smallest, yeah, then the medium sized handle, and then the larger handle. So we want to see, because we said that the intensity of flexion of the medial 4 digits is affected by the size of the object being carried, right? Or specifically the size of the handle. I want you guys to look at what's happening. So as you can see, these handles they're the smallest handles, right? So if I try to carry it, as you can see, the intensity of flexion of this medial 4 digits isn't that much, right? Because the handle is small. Yeah. So this here is the hook grip, right? As you can see, my medial 4 digits are not that flexed. So now let's test out the medium sized handle and compare it to what we had with when we're looking at the intensity, considering the smallest sized handles. So if I can get the medium sized handle, so I want you to look at that. So if you can compare between the two, right? Let me just take away this. So if you can compare between these two, as you can see, the intensity here, right, it is greater than the intensity of flexion of these medial 4 digits in the first case. So as you can see with this bag, this is the hook grip in this scenario, right? So that is the intensity. That right there is the intensity of the flexion of those medial 4 digits in when you are carrying the medium size handle. When you're carrying this bag with the medium sized handle, right? So now if you can compare this, right, to this. So as you can see, the intensity isn't that much when you're looking at the medial 4 digits. That's the intensity of the flexion of those medial 4 digits in comparison to this here. So this is the hook grip when you're carrying the medium sized handle of the second bag, right? So now let's try it out with the largest handle and see how the hook grip changes. So if I can carry, so now check this out. So if I'm carrying this, the largest sized bag, as you can see, I'm even actually placing it at the palm of my hand to be able to carry it. So the intensity of flexion of these medial 4 digits in this scenario is actually, the intensity is the highest in comparison to the other two. So if you can compare this, right, this to this, so check out even where the tip of my digits are, you can see, as compared to how it was in the other scenario where we're looking at the largest size handle. So the largest size handle, we had our digits, we had the tip of our medial 4 digits actually touching the penile eminence, but in this case they are just touching the center of my palm, right? Yeah. So that is how size affects the hook grip, and even weight can also affect the hook grip. The heavier the object that you're carrying is, the more the hook grip required to be able to carry that object. So want to talk about the muscles that help you to carry out the hook grip. So this is the hook grip, right? If you can look at what is happening at my MCP joints, obviously you have flexion at the MCP joints, you have flexion at the proximal interphalangeal joints, as well as flexion at the distal interphalangeal joints. So obviously, if you have flexion at the MCP joints, you have the lambicus helping you to do that, right? So obviously the lambicus, as we said, the lambicus, the lateral two, are innervated by the lateral and medial branches of the median nerve, and then the medial two lambicus are innervated by the deep branch of the ulnar nerve. If you have flexion at your proximal interphalangeal joints, you're obviously using the flexor digitorum superficialis muscle, which is innervated by the median nerve. And then when you look at flexion at the distal interphalangeal joints, obviously for you to be able to flex your distal interphalangeal joints, you need what is known as the flexor digitorum profundus muscle. Its lateral half innervated by the anterior interosseous nerve, and its medial half innervated by the ulnar nerve. So those are the muscles, as well as the nerves that help you to carry out the hook grip. So as we said, it is affected by the size of the object being carried, as well as the weight, because if you carry something with a lot of weight, obviously you're going to need more intensity of flexion of the medial field digits to be able to carry that large weight. And if you're carrying something lighter, you're going to need less flexion of your medial field digits to be able to carry that light bag. So that is all about the hook grip. So now we can look at the precision handling grip number 3. So now let me take this paper away. So now let's look at number 3. So the precision handling grip, as the word states, precision, it needs what is known as fine control movements of the digits of the hand, as I'm going to show you what fine control movements are. So in the precision grip, you have change in position of the handheld object. So being that you have change of the handheld object, it just means that that object isn't static, right? As compared to the case in the power grip and the hook grip, because in the power grip and the hook grip, we saw that this object is static. As you can see, this was the power grip, right? This was the power grip, and then I actually demonstrated the hook grip by holding those different handles of those bags. But in the precision grip, you have your object, you have the object that you're holding in your hand changing position, meaning that that object isn't static. And so if it isn't static, you will need fine control movements of your digits, the digits of the hand. So let me give you what is that. So let's look at the examples, the different examples of the precision grip. So first and foremost, you have holding a pencil or a pen. Then you also have manipulation of a coin. And finally, you have, there are actually very many, but for me personally, the final one that I'm giving you guys is buttoning a shirt. I'm going to show you in all these scenarios. So holding a pen, as you can see, even if I'm trying to write, I need to, obviously, as you can see, my pen is not static. If I'm to write my letter A, as you can see, my pen is continuously moving. I need to use fine control. I need to focus to be able to write these letters. So A, if I'm to make my B, I need to move my pen in different ways to be able to write this letter. If I'm to write my C, what's happening is that I'm continuously moving my pen, right? Even if I'm to write my D. I need to be able to write all these different shapes. I need to be able to move my pen in different ways. So that's what is meant by saying that the object in this scenario, it changes its position as compared to what was seen in the previous functional positions. So that's the first example with the pen. So now let's look at the coin. Let me just place that down. So basically we're at station number 3, where we said our pen, we've just demonstrated how our pen functions, how we hold our pen, and now we're testing out our coin. So this is the coin. So if I'm to move my coin, right, if I'm to just manipulate it and move it around, move it around there like that, turn it. Just try to see if I can turn it this side. What I'm doing, I'm using fine control movements of my digits. I need to focus to be able to move this coin around. So check that out. I'm just trying to pass it through these digits. So this is another example of the precision grip, right? So that is the manipulation of a coin, as I just demonstrated for you guys. So now let me give you an illustration of buttoning a shirt. So here I have my jean jacket, this here. So I'm going to try to place this button through this hole. So if I begin to place this button through this hole, it is not static. I'm trying to, it is being continuously moved by my digits, right? So that's why it is known as the precision grip. So for me to be able to do that, I need to continuously move this button with my fingers. Right? So that is the precision grip. Let me just try it finally with the third button. So that is the precision grip. As we said, in the precision grip, you have change in position of the object, and it is different. That's what makes the precision grip different from the other functional positions, the power grip, the hook grip, because for the power grip and hook grip, you have the object remaining in a static position. So now we are done with the precision grip. So now let's look at the pinching position, number 4, what's known as the pinching position, which I actually left it out in my list, but it's also a functional position. So for the pinching position, you're going to be using station 4 or our teacup section. So the pinching position, it is where you have compression of an object between the index finger and the thumb, or it's where you have compression between the thumb, right? It's this top pad and the adjacent two fingers, the index finger and middle finger. An example, when you are trying to snap your fingers, when you're doing this, you're actually doing pinching. I'm compressing, I'm having compression between the thumb, the palmar surface of the distal phalanx of the thumb, and the palmar surface of the distal phalanx of the middle finger. And actually, when I'm finishing when I'm finishing this snap, I end up with compression at the index finger, right? When I'm doing this. So that is another way you can actually apply the pinching. As we said, pinching can be compression between the thumb and the index finger, or it can be compression between the thumb and the adjacent two fingers, the index and thumb. So now let's look at the first case where we say that it's a pinching position is the compression between the thumb and the index finger. So what are the scenarios in which you can apply this pinching, the pinching position? So when you are trying to hold a teacup, as I'm going to show you guys, holding, or when you are seasoning with a pinch of salt, as the name implies. So if you have to apply this pinch of salt to your food, obviously you do this. So when you're sprinkling that salt, what you are doing in this scenario, you are actually doing the pinch position. As you say, it's compression between the thumb, can be compression between the thumb and index finger. That's the first scenario. So that's already done. So let's look at holding a teacup. So if you hold a teacup, this teacup of mine, if I'm to hold it, what I'm doing here, it is I'm pinching at its handle to be able to hold it. So if you're holding this teacup and you want to take tea, right, you apply a pinch position to be able to hold it. So this, here is how you hold this stick up. So these are the different ways in which you apply the pinching position, right? So we are now done with using our teacup station. Let me just return that back. That is the pinching position. So before I go to look at the muscles that help in the pinching position, let's first go back to the precision handling grip. So in the precision handling grip, I want to show you guys what muscles are functioning in this scenario, in this functional position. What muscles are, what actions do we have when we are looking at the precision grip? So I'm just going to use the example of me holding this pen. So let's begin with the thumb. So at the thumb, because we said when we're looking at the thumb among its functions, this here, when you are bringing the distal phalanx across your thumb, you are doing flexion at its interphalangeal joint. And then whatever action requires you to bring the thumb across the palmar surface of the hand is flexion. So you have flexion at the interphalangeal joint as well as flexion at the MCP joint. So the two muscles in this to help you with flexion at the interphalangeal joint of the thumb and MCP joint of the thumb, we have the flexor pollicis longus and the flexor pollicis brevis. Flexor pollicis brevis. Pollicis brevis. And as we said, the flexor pollicis longus is innervated by the anterior interosseous nerve, and then the flexor pollicis brevis, it has a superficial head which is innervated by the recurrent branch of the median nerve, and it also has a deep head that is innervated by the deep branch of the ulnar nerve. So that now we are done with the thumb. So let's go to the index finger. So at the index finger, you have flexion at the MCP joint, right? You have flexion at the proximal interphalangeal joint, and then you have extension at the distal interphalangeal joint. So at the MCP joint, you have the lumbricals, basically the lateralmost lumbrical. In this scenario, when you're looking at the index finger, you have the lateral lumbrical, lateralmost lumbrical. But obviously, when you are writing, so if you're writing, you have flexion at all the MCP joints. So you have all the lumbricals helping to primarily flex these MCP joints. So obviously, you have, if all the lumbricals are functioning, the lateral two are innervated by both lateral and medial branches of the median nerve, and then the medial two are innervated by the deep branch of the ulnar nerve. So the lumbricals helping to flex the MCP, helping to primarily flex the MCP joints. And so if you can go on to the proximal interphalangeal joints, as you can see, these proximal interphalangeal joints, they're all flexed, and then it is only the index finger that is actually extended at its distal interphalangeal joint, and the rest of these digits, the middle finger, ring finger, and little finger, they are flexed at their distal interphalangeal joints. So if you have, so we talked about the proximal interphalangeal joint being flexed of all these digits. So that is made primarily by the flexor digitorum superficialis, which is innervated by the median nerve, and then the middle finger, ring finger, and little finger, they have flexion at their distal interphalangeal joints. So that is specifically the flexor digitorum profundus muscle. Flexor digitorum profundus functioning there. And then if you have extension at the distal interphalangeal joint of the index finger, you have the extensor digitorum and the extensor indicis muscles in this case. And these two extensors are innervated by the posterior interosseous nerve of the radial nerve. So which is a branch of the radial nerve. So those are the muscles that help you to carry out the precision handling grip. So now let's come back to the pinching grip. So in the pinching grip, this is the pinching grip, right? So this pinching grip that we actually looked at when we were looking at damage to the anterior interosseous nerve, if you're looking at the index finger and the thumb, you are having if you're to do this, if you're to hold this cup like this, having extension at the MCP joint of the thumb and extension at the interphalangeal joint of the thumb, and then I have extension at the, if I hold this, I have extension at the distal interphalangeal joint of the thumb, sorry, of the index finger, and I have flexion at the proximal interphalangeal joint of the index finger, and the MCP joint of the index finger in this scenario is flexed. So if let's begin to write. So if you look at the thumb, we said we have extension, the thumb at the distal interphalangeal joint. Which is made possible by the extensor pollicis longus muscle that actually attaches to the base of the distal phalanx of the thumb. So let's look at the thumb, sorry, the index finger. So the index finger, you have extension at its distal interphalangeal joint, as well as flexion at the proximal interphalangeal joint and flexion at the MCP joint. So the index finger you have extension at its distal interphalangeal joint, which is made possible by the extensor digitorum and extensor indicis muscle or indicis muscle. Then you also have flexion at the proximal interphalangeal joint and MCP joint. So we already talked about these joints in terms of their flexion, and we know that flexion at the proximal interphalangeal joint is made possible by the flexor digitorum superficialis, and flexion at the MCP joint is made possible by the, in this case, the lateral most lumbrical that functions at the MCP joint of the index finger. So now that is the pinching position. So now let's go to the fifth position, which is known as, before we go to the fifth station, which is known as the position at rest. So the position at rest, what happens when you place your hand on a table and you're resting your hand on a table with the back of your forearm on the table, right? What happens is that your hand, if you can look at your hand, you don't place your hand like this. You don't place the palmar surface of your hand flat on the table. What happens is that when you're resting your hand is in this kind of position. So your hand is kept in this position with mild extension. As you can see, if this is your wrist is in a mild, it has a mild extension. You have mild extension at the wrist. You have flexion. You have, if I can also call it, mild flexion at the MCP joint. You have flexion at the proximal interphalangeal joints of these digits, and extension at the distal interphalangeal joints of these medial 4 digits. So that is how your hand is placed at rest. And this is all made possible by what is known as tonic contraction of the different muscles that help you to flex specifically at the MCP joints, flex at the proximal interphalangeal joints as we've just talked about them, and extend at the distal interphalangeal joints of these medial 4 digits. So because of that tonic contraction of the flexors of the MCP joints, proximal interphalangeal joints, and extensors of the distal interphalangeal joints of these medial 4 digits, and extensors at the wrist, you have what is known as the rest position of the hand. So this is the rest position. This is how you rest your hand on a table, as opposed to this. This here is forced, but this here is how your hand is in the rest position. And it can also be, this rest position can also be used when you are placing your hand in a cast. If, let me say, you have a fracture and they place your hand in a cast, what happens is that this is how your hand will be. It will be in a rest position. So this is how your hand will be. So it won't be flat like this. It will be in this in this positioning, as we've just seen, this position. As we said, because of tonic contraction of the flexors of the MCP joints, proximal interphalangeal joints, and the extensors at the distal interphalangeal joints and at the wrist, because we said we have mild extension at the wrist. So that is the position at rest.